Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 9 common ineffective back pain treatments. But before I do that, we need to understand what is back pain and the normal healing cycle so it makes sense why those treatments are not effective. So when you have a back pain either from sciatica, herniated disc, or fibrotic tissue or piriformis syndrome, usually the problem occur in this area that you will have inflammation and some issues with the proliferation stage. I'm gonna go over normal healing cycle so you can visualize what happened internally because the skin cover it so it's hard to see it. So I'm gonna use this example for visualization. So the first stage of healing is inflammation. So when you have a paper cut, as you see in the first image, you start to have swelling, redness, the blood start to rush to that area and you start to experience pain. The second stage of healing, it's called the proliferation stage. That's when your body starts to build fibrotic tissue, scar tissue. And during this stage, you start to experience fascia restrictions, muscle spasm, and trigger points. Perfect scenario during the maturation stage, the body should clear up everything from the inflammation and proliferation stage. And that's indicating that you are healed and complete the healing cycle. But if you still experiencing back pain, very high chance you are going back and forth between the inflammation and the proliferation stage. So it does not matter what kind of injury you have, either herniated disc, it's inflammation pushing on the nerve. You might have orthotic changes here, fibrotic tissue, and it could be also soft tissue involvement here, fascia restriction and scar tissue that pushing on the nerve in the back that causing back pain, and you could have some radiculopathy pain. So usually when you experience that pain, your body is going back and forth between inflammation and proliferation stage. So why this is important to understand, because when we relate the treatment to how they address the normal healing cycle, it will make sense why it's working or it might not work. So when we look at the current treatment and based on the studies, those common treatments like ice and heat and electric stimulation. So when you look at the healing cycle, ice temporarily will decrease inflammation, but it's not going to do a long term for the decreasing inflammation, or it will not address the proliferation stage properly because it's not going to release any adhesion in the tissue. So electric stimulation, based on the studies, it provide temporary pain relief for half an hour to an hour, but that does not really do much to the root cause of the issue. The other common treatment that used foam roller, which is actually rubbing on the area that inflamed, which actually could cause more inflammation. The same thing for massage, it does the same thing, causing rubbing force on the soft tissue that might cause more inflammation, but massage is not even targeting the fibrotic tissue, the fascia restriction in the proliferation stage. So other common treatment, acupuncture or dry needle, using needle on the back area, but if there is no relation that correlate between those treatments and decreasing inflammation, and if you don't have enough targeting mechanical force to addressing those issues of the fibrotic tissue and the fascia restriction, those treatments not going to do anything to address the normal healing cycle effectively. The other common treatments are joint mobilization or joint adjustment, and that's basically moving the joint. But the problem is inflammation and proliferation. When you move the joint, if it's inflamed, it actually could inflame it more, but it's not addressing any soft tissue that actually causing the main issue for the problem. So one of the common things that's used, and you actually probably heard a lot of stretching recommendation on YouTube, and I personally do not recommend it for my patient because based on the studies, stretches is actually cause inflammation. If you overstretch, that will cause micro tear in the muscle. Think about it this way. Your muscle like a rubber band. When it contracts and relaxes, stretch. So if you have a micro tear or inflamed area and you keep stretches, you're going to inflame it more. And unfortunately, I had a lot of patients that when they watch YouTube videos about doing stretches, especially the performance stretch and hamstring stretch, they actually have more aggravation of the symptoms. So I personally do not recommend stretching to my patient. There is other option that actually much safer than stretching to address the problem itself. So the other thing that's very commonly used is strength training, which actually if you do strength training while you have a lot of inflammation, you're gonna inflame it more. So I prefer to do function training instead of strength training, biomechanic alignment, posture training, and body mechanic function training that's more effective than strength training based on the studies. And if you do the strength training during the inflammation stage, that will make it worse. I will leave a link underneath this video for the 3 most effective, powerful treatment that naturally relieve back pain. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to ASTRinstitute.com.